At the Darwood and Tanner practice, we see every kind of patient who have needs ranging from conventional crown and bridge work through to straightforward implant dentistry, all the way through to patients who require reconstructions following tumour removal or trauma. Every aspect of what we do has absolutely been changed by advances in digital dentistry, and 3D printing is that most important tool that allows us to interface physically with our patients. So we're able to treat patients with less time, more predictability, higher levels of accuracy.
A huge advantage of being able to have a 3D printer in-house is the speed and efficiency of what we can offer and deliver to patients.
We can create models that allow us to precisely plan how we're going to carry out an operation. So here we've prepared the model using surgical instrumentation in just the same way that we might actually go to treat our patient. If I were the patient, I would rather the surgeon practiced on a model than practiced on me. 3D printing has allowed us to be less invasive, to reduce operating times, and to get our patients into a better state faster. And having a multi-material printer in our practice has allowed us to go that much further. 3D printing therefore makes digital dentistry practical in a surgery environment. So we're using biocompatible materials for surgical guides, so we can do everything with one printer. Using multiple materials at the same time means that we can combine our surgical guides with ordinary study models, prosthodontic models or anatomic models without actually having to carry out multiple prints or without having to use multiple printers.
So we use an acrylic monomer for the print material for the guides, and these layers are printed in 30 microns, so it's very fine. Then I send it off down to the printer, and I can even be press and print overnight so that when I come in the morning, I'm just removing the support structure material and then I'm continuing with the full fabrication of the guide.
The Stratasys Objet Dental Selection 260 printer, it served all our needs. It was perfect for surgical guides, perfect for prosthodontic models, perfect for anatomical models. It could print in multiple materials. It was quiet, enclosed. Materials came in clean, tidy cassettes. Removing support material was straightforward, and basically it ticked every box for us.